have with us Dr. Indu Bhushan. Dr. Indu Bhushan is a 1983 batch IAS officer from the Rajasthan cadre. And he took voluntary retirement, early retirement from civil services and went on to World Bank and then to the ADB, the Asian Development Bank. Had a long illustrious career at ADB. And when the current government, the government of India, was conceptualizing a health assurance program, a health coverage program that will cover more than 50 crore Indians, and they were thinking who could actually lead this program, they reached out to Dr. Indu Bhushan, requested him to come back and lead Ayushman Bharat. And later on, he was also the first CEO of the NHA, the National Health Authority, agency where it was all housed Ayushman Bharat. He not only conceptualized design, but really in a very short span of time made Ayushman Bharat a success. And that's the journey that Dr. Indu Bhushan has agreed to talk to us about. And really looking forward to it. Just for everyone's knowledge, NHA is also the entity that subsequently during COVID housed COVID platform that all of us have used for our vaccines and so on. And now it's focusing on what's called the Ayushman Bharat Digital Mission, which is really trying to kind of structurally solve for healthcare in the country for the long run. But it all started with Dr. Indu Bhushan. Welcome, Dr. Indu Bhushan, and over to you for the story of Ayushman Bharat.
Thank you very much, Gaurav, and thank you very much for inviting me. And it's always a daunting task to speak after Anil Swarup. He's such a great speaker, such a captivating speaker. And there's a fun fact which you probably didn't share and probably you don't know, is that I started my career with Anil Swarup. Anil Swarup is 81 and I'm 83 batch. And when I was posted to district, he was my STM and I was probationer. And so I learned a lot from him. And as the luck would have it, when I finished my government career, he was the first one I went to because he had done a similar thing before and I wanted to seek his advice. I was far away. I had been away from the government for a long time. So, and as you would see from my presentation, I'm not as good speaker as Anil Swarup, but I'll try to share what I did. And my first goal will be not to let you go to sleep and keep it slightly more exciting. As Gaurav was saying that I used to be in Asian Development Bank. I was there for 21 years and was actually sitting on my treadmill. I remember it was, I think, 30th of March. I was told that there's a call from Delhi. And usually I pick up the call from Delhi because it could be from my parents or some problem, and I was a little worried. It was from PMO, and so I spoke to, at that time, Joint Secretary, and he wanted me to come to Delhi to have a meeting with the Principal Secretary. And in government, things move very slowly, but when I came here, and within 15 days' time, they told me that they wanted me to shift to Delhi and leave my job in ADB to head this work. And next slide. And so, of course, I didn't have a choice, and it was a very exciting opportunity, and it was a blessing, and I really feel very fortunate that I was selected to implement this scheme. But when I came here, I had only two staff, myself and one other government person, and 7 pages of cabinet note which was approved, and a very clear objective that we had to provide 5 lakhs worth of financial protection for more than 50 crore people, about 10.7 crore families. And we were told that the scheme is going to be launched at that time on 15th of August. So we were given about 6 months to implement the scheme and put it on at that massive scale. Of course, that was a daunting task, given that we were just at 2 rooms and 2 people. And so first thing that we did was sitting down. We tried to see what the problems are that we need to solve. And I think that is the first thing that one needs to do. Without that, of course, you can't even find the solution. And look at the questions that we need to. So next one. So there were a large number of questions in terms of designing the scheme. How will we identify beneficiaries? There are 50 crores of them. What kind of benefit package we are going to provide? Like what kind of support, what the number of benefit packages? How will those packages be priced? How much we'll pay for those packages? What kind of hospitals are going to be impaneled? Do we impanel all hospitals who come, or we have some limit that we need to draw? Or how will the hospital be paid? Will the government pay them? Will the insurance company pay them? What kind of structure we create? And what kind of structure we create at national level, state level were huge a number of issues. So we had all those questions. Then second question was that health, as you know, is a state subject in our constitution. So the states can decide whether they want to join this scheme or not. And so there are 36 states and UTs. We had to onboard them. First of all, for onboarding them, we need to convince them this is the scheme, and these are the various elements of the scheme, and do you want to be part of it? After that, there was a problem that many states, they were already going on schemes, and the schemes were some of them are really good, and how to convince them that Ayushman Bharat is a better scheme, or by merging with Ayushman Bharat, your scheme will become better. Of course, that was a job that we had. And also in many states, we had to build capacity and implementation structure almost from scratch. So doing that in 6 months' time, identifying people, training them was a big challenge. Next one. Other challenge was beneficiary empowerment. We have these 50 crore people all around the country, but they don't even know about the scheme. And if they don't know about the scheme, then of course they should first know that they are the beneficiaries. These are their rights, these are their benefits, and if they have a problem, this is how they can share their grievances. So that was another problem. Now, before going to the beneficiaries, we also have to see if we have hospitals. It's like a typical problems, for example, Uber faces when they introduce Uber in any new city. That first, should they get the customers, or should they get the drivers, the cab drivers? If they get only cab drivers, and cab drivers won't have any work, and so they'll won't have motivation to join Uber. At the same time, if you get customers and there are no cab drivers, then obviously customers will slowly go away. So same problem with Ayushman Bharat. So we can't empower our beneficiaries. We can't tell them these are your rights unless we also have hospitals who are going to be providing services. And so we have about 40,000 hospitals, some say 70,000 hospitals, how to empanel them, how to ensure, more than empaneling, that they are going to be providing quality services. In the health sector, there's a problem of asymmetric information. When a person goes to hospital, of course, providers know much more about what kind of treatment to provide as compared to the patient. And that problem, to ensure that patients are getting not only services but quality services, how to ensure that, how to recruit staff at the hospital so that they can manage the scheme properly, how to train hospitals about the scheme and what kind of process are going to be followed. Also, the creating supporting system for hospitals. Suppose IT system is not working or something else is not working, or they have a question, who would call and provide answers, seek answers from. Next one. And then a payment mechanism system. Suppose we have to have payment done through insurance company, then of course we have to identify insurance companies through an open bidding process and put them in place. If it has to be done by a trust or the government themselves, then we have to have those arrangements done, and doing that in 6 months' time and training all those people was a challenge. And final, there are a large number of challenges, but I'm sharing some of them. And the final challenge that we were looking at was that we had to build an IT system, and creating IT system and ensuring that the data that we are collecting was secure, it was private, it didn't have any glitches, the data would not leak out, was an issue. Establishing a call center, because we were expecting large number of calls, and actually I'll come to that later. That once the Prime Minister announced the call center number that you can call 54777, we were getting calls in lakhs, and so supporting those calls in lakhs from day one, of course, was a challenge. So it's a huge challenge which we had to support within 6 months' time. And this was a scheme, since it was a flagship scheme of the Prime Minister, and he himself was monitoring the progress on monthly basis, it was something that we couldn't fail. So doing all that with a small number of team, and almost no resources to begin with was a challenge. And so, of course, things happen, and thing happened, and I'm very proud to say that our scheme worked. It was working from day one. Our IT system never failed, and in first year of operations, our operation, we provided 80 lakh treatment, and everything was end-to-end, paperless, cashless support. And the way it happened was that we followed a lot of management principles that I'm going to share, and many of them overlap with what Mr. Sarup was mentioning. Number one is, you should never try to reinvent the wheel. Lee Kuan Yew, when he was establishing the systems in Singapore, and in early 50s or early 60s and 50s, his goal was to make Singapore like Sri Lanka. He thought Sri Lanka was the best model at that time. And he sent around teams to different parts of the world because he believed that all the problems that we have right now, someone else would have solved them already. So we were looking around and we saw which other schemes have been in place from where we can draw lessons. And in administration, governance, it's not like academia, and plagiarization is not a bad word. And we very shamelessly copied whatever we could copy from other schemes. So biggest support we got was from Rashtriya Swasthya Bima Yojana, and this is the scheme that Mr. Sarup had started, and it was a precursor of Ayushman Bharat, although it was on a much smaller scale and it also had some problems. So a lot of guidelines, policies, bidding documents, draft contracts, training material, and many other things that was being used in the Rashtriya Swasthya Bima Yojana, RSBY, we just adapted them. We just took them on board. We also looked at many state schemes which were doing very well, and in particular Telangana had a good IT system. We asked for that code, and we used that code and built our IT system on top of Telangana. So that was the one that if you can find something which is already there, you don't need to focus on recreating it. So that was number one. Number two, many past experiences also are not good experiences. So you should not follow what has not worked. Like Mr. Sarup was saying, that if you made a mistake, that's not a problem. But following that mistake, doing the same thing that you knew was wrong is not correct. And this quote, some people attribute this to Einstein, but there are some doubts that insanity is doing the same thing again and expecting a different result. So you have to, when you know that something doesn't work, you have to find a different solution. And for example, one problem with RSBY was that it was a state-jacketed scheme where every state had to follow everything uniformly. We gave a huge amount of flexibility to states because we knew that their capacities, their context, their needs, their aspirations, their abilities are very different. So different states, if you look at Ayushman Bharat now, so it's not one scheme, it's 35 different schemes and running different states, you would find huge amount of differences. And we allowed states to co-brand Ayushman Bharat together with their local scheme. Second thing we found was that RSBY got a bad name because of fraud and abuse in many states, and that led to erosion of its brand value, erosion of its political support. And we were very clear that we have to have a system where fraud and abuse can be minimized, and if we can't, and anyone that we catch should be punished heavily. And so we built a huge amount of checks and balances on fraud and abuse. Third was on quality of care, and we ensured a lot of systems that we put in place to incentivize quality of care. We gave extra money to those hospitals which were certified for quality by NABH. We also had better payment done to hospitals which are teaching hospitals, and we put in place lot of documentation and standard treatment protocols for several of our packages to ensure quality of care. And finally, we built an end-to-end IT system, which was also a lesson learned from previous schemes, that unless the IT system is integrated and online, in RSBY, it was an offline IT system, and the systems were not linked to each other. And that was a major problem in terms of ensuring effective implementation. And that was one thing that we used. Third lesson that we learned was that innovation can accelerate the implementation. Many of the problems that you see can be managed by many of our existing IT systems, but also many other innovations. So I spoke about end-to-end IT system, which was put in place within 6 months' time. We also heavily used AI and ML for prevention of fraud. We used to get a report every day in terms of doing big data analysis. We used to be getting terabytes of data every week, and we would be running it through our system and algorithms to see if there's a problem. If one hospital, for example, is doing a large number of cases for which they're not equipped, they're doing large number of cases on one person or one family, which is out of line with the expected number of treatment that one family should receive, and things like those. We also put in place a transparent live monitoring system. We had an open database for beneficiaries where they can go and see if they're a beneficiary of the scheme or not. They could call a number. And we also provide incentive for quality healthcare, which I spoke about. So a lot of innovations can actually address some of the inherent problems that you see in implementation. Fourth lesson, I would say, is that you should have a team. Of course, we should have a strong team, but I'm emphasizing the fact that the team should also be diverse, because unless we have diversity in the team, people coming from different perspectives, I think many times what we do is we talk to each other in echo chambers, and we have people who are have a similar background, similar thinking, and that is not where the best ideas, best discussions and best outcomes come. So having a diversity in team is extremely important, and we very on purpose selected a very diverse team, which was diverse in terms of age. We had elderly people like me, but a lot of people in 20s, 30s and 40s. We had a lot of people from outside government. We had a good combination of generalists and specialists. We had about 50% of our team was women, and we had people from different sectors, insurance, health, IT, and others. We had people from, so it was a very vibrant team. If you visited NHA, and I think it also still exists. If you go to NHA, National Health Authority now, it doesn't look like a typical government office. It looks more like a Google, or where people, you'll see that energy and dynamism just by visiting that place. Next challenge was, next lesson was that partnerships matter. And there's an African saying that if you have to go a short distance, you can go alone. But if you have to go far, you have to go in groups. So in jobs also, if it's a simple job, has to be done overnight, it's always best to do yourself, because you can't really do it in a team or a committee. But if you have a complex job, or it's a job which requires long-term support, you have to do it in big group. And here we had large number of collaborators. We had other ministries, Ministry of IT, Ministry of Rural Development, Ministry of Education, and most of them supported us. There are a lot of community-based organizations, CHCs, which were issuing our cards. A lot of development agencies were supporting us. And apart from that, we had influencers, including media and politicians, a lot of MPs, and we would go and make presentations to them so that they are supporting the scheme. And think tanks, we would provide data to think tanks to do articles and analyze data and give us feedback. And the final lesson that I want to share with you is that transparency and monitoring is critical. And for that, we had a dashboard which was open to public from day one. They could see what is happening in the scheme. They could see how many cases have been done, in which state, not only which state, which hospital, and what kind of cases, so that actually transparency puts pressure on us and also ensures that there's a public scrutiny. And we were also having a platform where hospitals can track where their payment is pending, for how long, and that was available to all, and we could follow that. So I'll just end with this quote. So there was a quote which actually is not here, I done that in the revised version. So Salvatore Dali had once mentioned that you should not worry about perfection because you'll not achieve it. But I think that's a negative thought, and a positive thought comes from someone else, who says that of course perfection is not attainable, but if you chase perfection, you might achieve excellence. So I think chasing perfection still is a good idea, and knowing that you'll never achieve it, but at least chasing perfection, you will achieve excellence. So thank you very much, and I'll be very happy to respond to any questions that you might have.
Yeah, thank you, Dr. Indu Bhushan. I think very, very good presentation, especially the lessons you tried to call out from the Ayushman Bharat journey, and a lot of them are applicable in any sphere, in any project, in any transformation which one may be driving. And really like always when I hear you, the humility with which you explain and the simplicity with which you explain a complex mammoth challenge, I remember at the time, but I think you make it sound fairly easy. I'll start by one question of my own I've been always wanting to ask you before I kind of take audience question, and that is when you actually made the shift from ADB to government back, and I know you spent a lot of years in international development, multilateral organizations before coming back. What were a couple of things that you were pleasantly surprised with when you came back to the government after a long time? And what are a couple of biggest challenges that you felt operating back in the government system?
Okay. Thank you for that question, Gaurav. You're right. I was away for 25 years before I came in. And of course, Asian Development Bank and before that, World Bank are extremely different as compared to this milieu. And so the room I I walked into my room, and one thing which I noticed, which made me think that nothing has changed, is that I had this chair, and on the back of the chair there was a towel. And we used to have this towel, like when I was SDM or before that, that towel was a symbol of and I could understand the use of towel in those times in 80s when there were no air conditioners because people were sweating, and but it was still there. So I thought maybe things have not changed. But I was pleasantly surprised. One, there was a huge change in terms of use of IT. And use of IT in Government of India actually is at par with all the international organizations that I have worked with. And so although it is also correct that the IT system itself can improve, and people's willingness to use those IT systems can also change, because I know that my successor, for example, in NHA, he still gets all the files printed before signing rather than do it on screen. So, and he's not alone. I've seen others also in doing that. So the systems have changed a lot in that sense, and people have become one thing which has not changed, or of course in this bureaucracy, is there's still a lot of obstacles in doing small things. If you have to even recruit a small, like your PA or anyone, the recruitment is a huge issue. Getting anyone on government role is almost impossible. You would take about 2 years. I was there in the government for 3 years, and We were working with the people that we had hired through international agencies or as consultants. Recruiting people on government role was extremely difficult. Kind of approvals that you need from UPSC, from Department of Personnel, from others is huge, and understanding those minute points that I think is also challenging. So I think the short answer is that we need to do a lot of work in terms of reducing bureaucracy. But at the same time, what we see is that use of technology, use of both IT but also communication technology, because this concept of having for each task one WhatsApp group is very new, and it happens mostly in India. Outside India, in the US, in other places, the use of WhatsApp is not that much. So I think, and it's extremely effective, And I was discussing about all those 6 verticals, what to do in IT, what to do with the hospitals, what to do with beneficiary empowerment. We had all these groups working on this. We'll have more WhatsApp messages in the morning. We'll get together on a whiteboard. We'll write down what is to be done today for each of these things. And the next day morning, we'll come back saying that what was done, what was not done. So all that could be followed through WhatsApp groups. And I think that kind of energy is, and I found that quality of people is like as comparable to anywhere I've seen. And some of my people, they can walk into any of the international organizations that I work with, whether it's no surprise that many of the multinationals are being headed by Indians, and the kind of talent we have, I think it's also amazing.
Giri Prabhu from IRMA is asking that given the magnitude of the program and the expectations of people around, and not everyone being a believer that it will kind of work and it can actually happen, what were some of the things that went on in your own mind as the leader of the program, and what were the internal mind games that you were playing with yourself in that period? Of course, you were a seasoned leader by then, but still something of this magnitude. How did you kind of keep yourself at it in spite of all the surround sound?
You're absolutely right, Gaurav, because when I used to think, and we started the whole thing in terms of magnitude of work that needs to be done, I would have a lot of sleepless nights. Of course, we were working day and night, but 1,000-mile journey always starts with one step, and that was my motto, that let's not think of the end result, but let's systematically work towards it, and we'll see where we go. And I used to have excellent advisor in IT, Mr. J. Satyanarayana. He was really a wonderful person. He's extremely he not only he knows his subject, but he's so thorough and sincere, hardworking, and committed. I have yet to see a professional like him. So he told me around, I think 2 months into my job, he said, Indu, this IT system is right now is at a stage where even if you want to start implementing the scheme in next year, 15th August, you can't do it. And that actually really blew me away. I said, oh my God. So we got together with him. I'm going to say, but that is not an option. So he said, if you want to do this, we need to get so many more people, so many more resources. I said, okay. So we'll get those many people, resources. Of course, government didn't give it. So we actually went to one of the development partners, and we said that, this scheme requires these resources. And luckily, those people decided to give us for 3 months that kind of resources. So you're right that at that time, many people didn't give it. Someone keeps calling me. I just give give the scheme a chance. And as a matter of fact, I know for sure that this job was offered to many additional secretaries. They didn't take up the scheme because of the two things. One, they thought that it has impossible goals and anyone who takes it up is bound to fail. Second, within a year's time, elections are coming and it's a very political scheme. So if you get branded with this scheme, probably it's the end of your career. So obviously there were not many takers. But I am very glad to say that after I left, I think there were a lot of people who were keen to come and replace me. And of course, I was replaced by someone who was 5 years my senior, which I see it as a success that if a person of that seniority is keen and willing to come and work as a CEO of this, I must have left behind something that people want to do.
Yeah. Great. You mentioned about partnerships and you mentioned about forging partnerships and working with people, and that was one of the strengths and lessons of Ayushman Bharat. Ishan from IIM Lucknow is asking that what are some of the things that you would always keep in mind while getting into a partnership? How would you select these partners?
Yeah. You know, Ishan, you have to see that you have certain kind of skills and capacity. So one thing is that if you want to multiply your capacity, you need to have more partners. Otherwise, you can do only very limited things, especially in a scheme like this. But second, I think more important thing is that you don't have all the skill sets, and so you need to get other partners. For example, data security and data privacy. You have to partner with the people who are doing that. It's the same thing with the in-depth analysis of data that needs to be done. So in first 2 months, I met with the Secretary IT, and he told me that we have a organization which deals with CSCs, and I didn't have any idea what CSCs are. These are community service centers, and there are about more than 2 lakh centers all over the country, and they have access to IT. And CEO is Mr. Tyagi, who's a batchmate of Mr. Anil Swarup. And when I met with him, and he was very enthusiastic that he can take on Ayushman Bharat in terms of ensuring that cards are made in CSCs, and if we can pay them 30 rupees for issuing the cards. Those kind of partnerships where we can expand our outreach, we can complement our skill sets, and we can, of course, partnerships are required also for political purpose in terms of ensuring that the right kind of messages are being sent from our scheme, and some partnerships are there for minimizing the damage because you don't want some people to be on the other side. You rather be them supporting you rather than blasting you for something wrong that you've done. So we used to spend a lot of time in Parliament talking to MPs and others whenever we saw some problems, and that actually helped in terms of ensuring that the schemes were taken up in their states. But also managing media was an issue.
Thank you, Dr. Bhushan. I'll just take one last question. There are many, but I'll take one last one. Shifali is asking that what would be the different paths for young talent, which is to contribute to solving some of the challenges our country is facing from outside the government system. Given that you've worked with so many young professionals and on, what are your thoughts and advice on that?
Well, of course, we have India's country, not one country. It's we live in multiple countries and multiple times, so huge amount of challenges that we have. So I think one has to pick up the kind of areas that you work in. Of course, potential is there in the field of I would say IT, but also looking at research, data, and others as well. In terms of one of the major problems that we have in the government is that our feedback loop is very weak or almost non-existent. So we implement policies, we have all these programs, but to the top level, especially to the secretary or the head of those programs, the feedback whether how that those programs are happening at the field level, whether they're achieving their outcomes or results, is not there. So my sense is doing that kind of work and providing that feedback that these things are not working in the government might help in terms of redefining those priorities and approaches and fine-tuning some of these programs. That will be one of the work that young people can help the government with.
Thank you. Thanks a lot, Dr. Indu Bhushan, and a pleasure listening to you as always. As I keep saying, you make it sound simple. Some of the most complex things that have been done. So thank you for your time.
Thank you, Gaurav, and thank you for having me on this forum, and thank you all for putting up with me.
Thank you so much.